when a woman can decide when she wants to have a child, if she wants to have a child, with whom she wants to have a child, she can decide many other things in her life. You know, women are deciding many things already in Africa. By the way, I think this continent is just made buoyant by the power of women, you know, what women are doing out there.
Hello, and welcome to another episode of Break It Down podcast. Remember, Break It Down is your go-to space for interesting conversations on health and all of the development issues shaping our world. I'm Chibike.
And I'm Asari. We are very excited to have you here with us today because this episode we are diving into a very critical topic that impacts lives, communities, and economies worldwide. Do you want to guess what it is? Yes? No? Okay, I'll tell you. Family planning!
Absolutely. That's right, Asari. Family planning is not just reproductive health, it's empowerment, it's really about development, really. At the recent family planning conference, we had the privilege of sitting down with Dr. Samukeliso Dube. She is the Executive Director of the Family Planning 2030. It's an international non-profit that gets governments, organizations, across the globe to commit to investing in family planning. So it's really an interesting conversation.
That's great because this is genuinely one of my favorite topics.
So we're going to be featuring that interview with Dr. Dube in today's episode. And guess who had the interview with her?
You did, didn't you?
No, I was asking.
Was it not you?
You'll find out. Just listen. Yeah. All right. So good afternoon, Dr. Samu. It's really a pleasure having this opportunity to speak with you on the sidelines of the 8th Nigeria Family Planning Conference. So let's get started with a quick intro.
Thank you. So my name is Dr. Samu Dube. I'm the Executive Director for FP2030. Today is 6th December and just the sidelines of the Nigeria Family Planning Conference, which are getting me excited about the future of family planning. With the organization FP2030, we are leading the agenda on the narrative of family planning and rallying solidarity around the globe to ensure that family planning is deeply rooted in every country's development agenda.
Can you talk a bit about that leadership journey of FP2030 since you took over?
I don't want to say since I took over because okay. I'm, also standing in the shoulders of giants who actually conceptualized this notion of building solidarity for family planning way back in 2012 when FP2030 then was FP2020, starting on a journey around 69 countries, LMICs, who actually were to be commitment makers. And then we had about 47 commitment makers who made a commitment and said, family planning matters to our development agenda. The goal then was to have 120 million new users of modern contraception by 2020. Quite an ambitious goal, indeed. And then whilst we didn't quite achieve that, actually we were near on our journey to achieve that. But in 2020, there was a conversation to say, let's have a different model that, would have a country-led agenda being in the forefront of everything that we're doing. Yes, globally connected, regionally coordinated, but country-led. And so that's when I took over. And since then, we've established regional hubs that actually are entrenching this idea of localization. We are working with countries to ensure that their commitments now are aligned with what partners are doing gap analysis at a country level, and helping countries to actually achieve the objectives that are in their commitment. And whilst we're doing that, we're also building global solidarity around family planning. Because one of the things about family planning, if you look at the history of family planning in many countries, it has somehow family planning saves lives, which is very true. But for us to ensure that it's part and parcel of conversations in any community or within any government settles, etc., we need to take it out. Make sure that it's still within the health settles, but take it out to make sure that it's in the socio-cultural norms of any developing country or of any country for that matter. So That is the second thing that we're doing. And the last thing that we're doing is building global solidarity. Because let's face it, one of the instruments or tools that we can use for gender equality is ensuring that women have sexual and reproductive autonomy throughout the globe. And it doesn't matter whether you're in Canada or the United States, where we just had elections, whether you're in Denmark or you're in Abuja. This actually is a true notion. We need to accelerate gender equality by ensuring that every woman can make decisions about their sexual and reproductive health and rights.
Awesome. Thank you so much for taking me through that. So I'll just go back a bit on something you said around solidarity, building that solidarity, getting those conversations to where it matters, and specifically making it a political conversation, because that buy-in is very important to sustain all of this the move or the momentum being built around this conversation. So I would like to know, especially in Africa, you see that at the global level, but it gives you that bird's eye view perspective of what's happening. So specifically in Africa, how are African countries making this conversation a political conversation? And specifically, are there examples that, where it's being done effectively, and what lessons can we take away from that?
We are certainly better than where we were before, thanks to many initiatives, and I'm going to talk about some of those initiatives that have made Africa actually increase and accelerate its family planning journey in many of the countries. The first thing to realize is that Africa has one of the youngest populations. And way back in 2017 and even before, the conversations were about Africa's demographic dividend. Let us invest in family planning because it's going to pay off in terms of dividends in our own people, right? And when you're talking about dividends, you can miss an investment opportunity. So I know many countries did miss that window of opportunity to really reap the rewards for that demographic dividend. Yet Africa still, in terms of family planning uptake, some of the countries have doubled, in terms of family planning uptake amongst users. We are seeing even a shift in what they are using within the method mix. We are seeing, and way back, one of the programs that I wanted to touch on is an implant access program. Where, because for you to really have a long-lasting effect, it's important to see many women actually using long-acting methods. And long-acting methods often are expensive. So there was an initiative really spearheaded by the Gates Foundation, working with private sector to ensure that we could increase and improve access to long-acting methods, especially implants. And we are seeing results right now where it has doubled in some of the countries. We talk about countries which may not have had reach, like Burkina Faso, where right now the MCPR is over 30%. That is actually because of the implant access program. But one of the issues that's important about Africa's family planning journey is somehow it is been linked to what politicians say or don't say when it comes to the narrative of population growth. Countries that have accelerated that journey really have great political buy-in at the highest level. Take Rwanda, for example. In Rwanda, we are seeing a great uptake, especially postpartum family planning. It's a leader around postpartum family planning, post-abortion care, because the leader is very clear that for us to really move the agenda on family planning, we need to actually ensure that all our primary healthcare facilities have got access, even at a community level, the conversation changes. It's not just a health issue, it is a development issue. Countries in sub-Saharan Africa, mainly, Botswana, Namibia, really are, again, leaders over 50% in terms of modern contraceptive uptake. Where we are still falling short is about uptake amongst young people. So teenage pregnancy in many countries is still high. We need to ensure that young people, we still invest in young people, and we regress because of the policies that we are seeing that sort of hinder access, complete access to contraception for young people, maybe because of our conservative values or because of many, policies that say, we should allow this to be in the mainstream and not this, and the backwards, I call it backsliding in comprehensive sexuality education in many countries. So we're seeing there we're still lagging behind in many countries. But overall, Africa is doing okay. But I would love for us to accelerate that journey. we don't necessarily have time. For us to attain sustainable development goals, we do need our politicians, our statesmen, our political leaders to take this like into the core development dialogues that they are having with their cabinets, with their members of parliament, and even with some of the bilateral institutions when they are talking about building a dam or whatever. It shouldn't be more important than ensuring that women have access to family planning and contraception.
One of the strategies that FP2030 put in place was around shifting power, was the regional hubs,
Yes.
creation of the regional hubs, so that those regions can prioritize, issues that are dear to them and help be at the front of leading those conversations. So I would like to know, again, the whole idea of this is to promote cross-learning. What can we learn from each other? So from those regional hubs that have been created, and you now have hubs in different, I know Nigeria is for West Africa, it's located in Nigeria.
Yes, Northwest Central Africa.
It's in Kenya. So looking at all of those since the implementation of that strategy, who do you think is doing, is leading that journey or that conversation so that others can learn from?
Just to correct you, the East and Southern Africa Hub is based in Nairobi in Kenya.
Yes.
And then Abuja is Northwest Central Africa Hub. And you know that this hub where we are today has got 33 countries that they are looking after. So yes, we are talking about the localization, but still it's vast. The region is vast and the need here in the region is vast. The idea around localization was to ensure that we can be closer to the countries, the proximity. So now we are seeing that proximity advantage. You could curate a conversation that's different when you are in Nigeria versus when you are in Washington, D.C. It's easier to communicate and to even be on the ground with the needs. But it's also easier to see patterns that can help you foster learning amongst countries. For example, we were in DRC in August, and DRC hosted Central Africa Republic, Cameroon, I think Burundi, and Chad, in DRC to say, let's learn from each other. We've got similar challenges around conflict, around low MCPR, around all these issues. I think we can learn, plan, strategize together, and make this happen. So that is starting to happen. And at any given time, my team, they are working with governments. They are in the country. At any given time, that's the advantage of having this localized approach for family planning. And the other thing is we are almost working to say, let's go all in and leave no stone unturned to ensure that countries can start to accelerate their family planning goals, given that SDGs, the targets are not being met, and that, 2030 is around the corner. So the advantage of localization is also that you can move with urgency and speed when you are working with countries. But again, you don't lose out on the globally connected nature of this agenda, solidarity. We want to build solidarity with many countries across the globe because, as I said earlier, family planning in Canada matters in as much as it matters in Abidjan and everywhere else in the world. So we are building that global solidarity by maintaining the global team that works with FP2030. That's what we are seeing. We're seeing more country ownership. We are seeing the regional South-to-South learning. We are also seeing that we are still part of that family that wants to see family planning as a key and pivotal part of development.
Yeah. But in all of these learnings, would you say anyone is doing it better, any of the regions? Or
there is always something that one practices better, and it's usually where the policy and the political will or even the financing is actually in place. One of the things that I've seen, I think more than 50% of the times, if you've got political will, things start to happen.
Okay.
And I gave an example of where Rwanda, we're seeing like a leader in the pack around, postpartum family planning, ensuring that when women, after they give birth, they do have access to family planning. They are a leader and they've institutionalized that approach within their primary healthcare system, within their secondary healthcare system, and their whole maternal, neonatal, and child health system. So they've done that very well. There are pockets of excellence as well when you go to many countries where, when you see the numbers, you go to Kenya, it's very heterogeneous because in Nairobi, for example, you can see MCPR that is shooting close to 70-something, but yet when you go to areas that are in the periphery even of Nairobi, you see a low uptake of family planning. So we're seeing these pockets of excellence. But I'll tell you one thing that I really trust in this. I think once women know that they can access family planning, which is why getting product is very important. We're working with UNFPA suppliers to make sure that there is a product at every point where a woman wants to use product, right? Once women know that they can use family planning, they often do not look back. You know, it's got this sticky effect that, you know, you go there and unless if a politician or somebody undoes that trajectory, women often, you know, they hold their own in ensuring that this happens. We are also seeing countries that signed up with UNFPA supplies in their compacts to ensure that product is delivered. We're seeing countries like Madagascar putting a lot of money in family planning. They are actually one of the leaders in ensuring domestic resource mobilization and financing for family planning. Yes, we are also like uploading Nigeria recently because they did release money that is going to commodities for family planning. So something is happening in the family planning space that I know once we get to a certain tipping point, I trust women and I trust that they will not look back.
Speaking of women, and so, you know, something you said earlier around framing the whole family planning conversation around beyond just family planning to you know, the bigger development conversation and context. And we're seeing a lot of that happening, especially tying it to how it impacts on maternal health. So my question would be, how is that playing out in the continent? Because of course we're focusing on Africa for now. How is that playing out? Are there countries where this integration is happening effectively that others can learn from?
The evidence and data is clear. Where there is high family planning uptake, you are seeing, you know, a reduction in maternal mortality. Absolutely. We've got evidence to show that. Where we're trying to change the narrative is that, yes, it's good, we should maintain that, but it's not enough. We need to ensure that now family planning is seen as now women can finish education. Girls can actually go to school, go to college, and enter the workforce, empowered, skilled with the tools that the country needs for development. Not only that, we are saying that when a woman can decide when she wants to have a child, if she wants to have a child, with whom she wants to have a child, she can decide many other things in her life. You know, women are deciding many things already in Africa. By the way, I think this continent is just made buoyant by the power of women, you know, what women are doing out there. And we are sitting here in Nigerian soil. The leadership in entrepreneurship is coming from Nigeria. And we know Nigeria is really set to be one of the biggest economies in Africa, and women are at the center stage of making that happen. So why not empower them and ensure that they've got that reproductive power to make those decisions globally and out there? My other hope, and where I'm also putting my money, is on young people. Young people are also changing this narrative that, you know, when I take contraception or an injectable or whatever, it's not that I'm preventing death. I'm not preventing my own death. I want to make decisions about my own life, my own future. So young people are also changing that narrative that this is just for birth spacing, etc. They are saying this is to allow me to finish college. This is to allow me to actually be promoted at work. This is to allow me to have a different trajectory and a different conversation in my life, which is enabled by family planning.
I would like to, again, so we've talked about Africa, but now bringing it back to where we are, Nigeria, especially this happening at the sidelines of the FP conference. So Nigeria has this ambitious goal of getting to a 27% MCPR by 2030. But again, it's one thing to have an ambition, it's another thing to put in strategies to get to that point. So from what you've heard so far, the conversations you've been part of, the engagements you've been part of, what are some of the strategies or tips or insights you think the government really needs to put their legs down and work towards to get to that ambitious goal?
One thing that I like about Nigeria and what the current coordinating minister of health, Dr. Pate, is saying is that, can we have one conversation? Can we have one plan, right? Can we have one voice around this? And we even measure the same thing. That is a good unifying force, because at least you know at a federal level there will be that plan. And that plan is through the FP2030 commitment, is through the compacts that the country has signed, is through the swap. Actually, there is a plan there. But you and I also know that action happens at a state level. So what I am seeing Nigeria do is to get we need governors on board. So if you're a governor, you're listening to this conversation, we need you on board to get Nigeria really on the map. We need governors to believe that this is not a population control thing. This is a development thing. Because people still use the language population control. No. This is a development investment. So as they are investing in family planning, they're investing in the quality of human capital of their states. And that is an important message. So I think the message that we're seeing at a federal level needs to permeate to state level, where governors are taking this as a message that they can never trade off when it comes to maybe even political decision making or campaigns, etc. That's one story. Nigeria, if you're looking even up north in Kanu, etc., we need to be talking to religious leaders to ensure that many of them are still gatekeepers of this agenda, but bringing them on board, we're starting to see results. Yeah. We're seeing them actually saying, we care too. We care about the health of our women. We care about the future of our children. And as they are coming on board, we are actually seeing traction. And states like Sokoto, etc., we are seeing, traction because of that leadership. So we need religious leaders to also come on board. We need governors, but we also, we say in my field, no product, no program. We need more than 4 million from the government to ensure that we do have product in Nigeria. Because if women go to clinics and they do not find what they are looking for, are they going to go back? Probably not. I think they will not go back. So we need to ensure that we invest in programs, and the 1% that the government had agreed on, I think could go a long way. Lastly, I do not think we are going to win as long as we exclude young people. Unmarried, sexually active young people need commodities too. And I think it's a group that we need to be catering for, we need to be counting, and we need to be making sure that services are out there that they need. And how do you get there? Ensuring that there is no provider bias. Providers who are actually, when women go there and I'm not married, why do you want contraception if you're not married? But actually, people are sexually active even when they are not married. And the other thing is child marriage. We still have high rates of child marriage in Nigeria. And if we could ensure that people can delay even their first birth or even delay their second birth and can do other things with their lives that would enable them to have a living. And family planning comes in even in those spaces. I'm proud of where Nigeria is going. There are all these seeds that are mushrooming around of success. Private sector is engaged. The government is showing leadership. We just need the states where action needs to happen to also come on board. In this conference, we saw commissioners that are coming from many of the states. They are also saying this matters too. For maternal mortality stats in my state, for even the MCPR, because they were almost competing. If you saw, I need to also increase MCPR. So something is happening, and I think in 2 years' time, when we have another conference, I am hoping that we'll be talking about a different MCPR for Nigeria, because clearly the 2% per year just for married women it seems to be huge, but still is not taking us where we want to be in Nigeria beyond the 27%.
Thank you so much, Dr. Samukeliso, Executive Director of FP2030, for your time.
Thank you. I appreciate this.
It's been a pleasure.
This was such an inspiring conversation, Chibike. I genuinely loved how Dr. Dube highlighted the connection between family planning and economic development. It's such a powerful perspective, don't you think?
Very true, Asari. I mean, for me, the biggest takeaway was that emphasis on community engagement, how especially what they did with regional hubs. So communities are leading this conversation. So rather, they have the global perspective, but they have hubs across the globe who are leading because they know what matters to them most. So how it's important to involve people at the grassroots and how it can break down barriers and drive real change.
Definitely. We hope you found this conversation as great and as inspiring as we did. Family planning is a topic that affects each and every one of us, and it is very important to keep these discussions alive. Remember, you can always catch the full interview on our YouTube page. So if you just go on YouTube, it's Nigeria Health Watch. You will find us and you will find these conversations there.
Yeah, thanks, Asari. Before we wrap up, we really want to hear from you, especially around this episode, what we talked about today. What do you think about family planning? Do you have questions? Do you have comments? Do you have stories about these topics that we bring up, especially the one we featured today, family planning?
Yeah, so make sure you reach out to us by emailing podcasts@nigeriahealthwatch.com.
Absolutely. And across social media, just search for Nigeria Health Watch on any social media platform. X, formerly Twitter, LinkedIn, Instagram, Facebook. We are all there.
Bye for now.
Until next time, stay safe.